Here at FDU, we focus on what we call interprofessional education. Interprofessional education provides students from various professions, pharmacists, nurses, physician assistants, occupational therapists, and others, an opportunity to figure out how to work well together. And at the center of that care is patient. We call it patient-centered care. So all of us basically figure out how to help the patient best and bring our unique expertise to the table.
It's demanding and it's challenging, but the reward is undescribable. I really say this to students. If I had to do my life all over again, that is one thing I would never change. It is one of the most rewarding professions that there can be, because you're caring for people, you're providing care, but you're also doing it on a more personal level. You're not the doctor with the title, you're just the person who comes in and provides care. I still get cards from patients that I had over 20 years ago, because you make that really nice connection.
I think social work is such a rewarding field, but at the same time, it can be difficult, right? You're hearing a lot of difficult stories, and really taking the time to care for yourself and whatever that looks like for you, I think is going to be key in being successful as a social worker or as a student in the program, but also just as a social worker. That's something that I would recommend beyond your MSW. In our program in particular, throughout the semester, we're always checking in on students, really encouraging them to engage in self-care. I often share what I do for self-care, just to kind of demonstrate and model that it's not only something that we talk about, but we try to practice ourselves.
Our faculty is very, very supportive, and unlike many other large institutions, we really pride ourselves in providing our students with the one-on-one support that they need to be successful. And all of our faculty have a lot of experience out in the field prior to coming into academia, and so really taking advantage of those mentorship opportunities to get the best guidance before entering the field. And a real unique component of our program here at Fairleigh Dickinson in our MSW program is the fact that our students are being exposed to practice levels across the spectrum. The majority of other MSW programs require students to select their level of practice, but at FDU we provide opportunities for our students to not only learn in their didactic courses, but also in their internship experiences. They're being exposed to practice across the spectrum. A big piece of our curriculum is the fieldwork education, and when students go out into their internships, they're provided direct support by our field director, and we allow them an opportunity to switch once they complete one level to the next, which provides an opportunity to kind of test the waters with a population that you might not know that you even like. And oftentimes when students come back after they complete an internship that they didn't really want at first, they're very excited and learn that they have a passion for serving a population that they never even knew that they liked.
A very important concept in public health is participation. Identifying issues that the students, the future students have. Look around yourselves and see what it is that is fine with you or what it is that bothers you. We can help you find the answers and to become advocate for that issue. When you are passionate, when you like what you do, I think that leads you in a successful direction and a successful career.
How am I as a human being? What moved me? Why would I want to be in a career of service, right? When I'm going to be analyzing other people's performance to adapt them and help them move forward and sustain that quality of life that I keep talking about. So as they make the decision to enter a healthcare profession, they also need to start looking at who they are, right? Knowing where you are and how you can be of service of others, I would say that is a great thing. And any profession, any undergrad degree can be reflective in getting to know yourself because of just the journey of learning.
If your journey involves becoming an occupational therapist, I think the most important thing is to be able to think outside of the box, right? Know what the box is, know what the foundations are. You're gonna learn about them, but have an understanding of it. But once you have that box, be able to reach outside of that box. How can you be creative? How can you change things? How can you come up with new ways to do them? That's really what we do as OTs, right? We see something for what it is. We take all the facts. We look at it, all of it, whether it be the person, whether it be the environment, whether it be what they want to do or need to do, and then we get creative. We figure it out, right? There's no one way to do it. Life is not black and white, and one thing that I really love about occupational therapy is that it's not black and white. It's that you can get creative, that you could figure it out. There's never one way to solve the same problem. There's so many different factors, and I think that's an essential part to students who want to be in the journey of becoming an occupational therapist. You have boundaries and you have the foundation, but then how do you get creative? The world is really your oyster.